Thank you so much. We'll invite the committee to come and answer some questions. You can just stay at the microphone. I guess if you had to, I'll just start. If you had to pick one of those several recommendations that you made, or set priorities, could you do that, or pick the National Haynes or the Youth BRFS, and what would you recommend to the committee?
Sure. Well, they're somewhat different because they have different starting points, and I think they're both valuable because, as we've been talking about all morning, the Haynes is broadly national, but the sample size for the groups that I was looking at is only a little over 2,000 children. And the Youth Behavior Survey is much larger sample and as a result provides much more geographic specificity, obviously. So for the Haynes, I think what I would suggest is parental English-speaking proficiency. I believe that it's possible in Haynes to gather data from parents for the children who are being examined. Parental English-speaking proficiency would go a long way toward telling us in developing policies, again, oriented towards families and neighborhoods and communities, what are the languages that we should be using for these programs, and to some extent, what are kind of the cultural mix of communities, families, and neighborhoods that we should be thinking about as we're trying to design programs or policies that are pointed toward those specific groups. So I think that would be my highest priority. My second might actually, for Haynes, might be legal residency for self and parents, because this is a population which is just hidden. They're very difficult to reach, but there are a lot of children, something like 4 million children living with children who have parents who are undocumented. So this kind of information could really shine a bright light on this group in the sense of identifying the extent to which they do, I don't know whether they have higher obesity rates or lower obesity rates, but to the extent that they are a population of interest, they will require, I think, very special kinds of outreach activities for obvious reasons. After that, I would say parental literacy in any language, to the extent that obesity reduction programs depend on written materials. Literacy at all, or in whatever language would be relevant, and then I would say specific Hispanic ancestry. For the Youth Behavior Survey, I would say country of birth for self and parents. I mean, this is the basic information we need to know whether children live with immigrant parents or not, whether they're immigrants. So that's the starting point. As I said, why the Youth Behavior Survey has none of the 10 data elements which I mentioned. Next, I think home language is, I would give priority. Followed probably by parental education. I presented results for bachelor's degree, but for some of these populations, 50, 60, even 70% of the children have mothers and fathers who have not completed high school. So it's a whole nother way of thinking about outreach to those populations. Parental education would tell us a lot about that for at least one of the parents. And then I would go to probably legal residency again.
Okay, thank you. Sherry.
Thank you very much, Don. My question is, if you look into the future of what we are expecting in America in terms of demographic shifts, how should we consider this in relationship to obesity prevalence and trends? And let me just give you an example as you're thinking through that. I'm the division chief of general pediatrics at the Children's Hospital at Vanderbilt. And over the past 5 years, we have had a tremendous influx of families from Saudi Arabia and Egypt. And what we measure in our clinic is their rates of obesity coming to America are very high. Now, at the same time, we've had an influx of families from Burma and Nepal. And what I can tell you from measurement in clinic is that they are failure to thrive. So if I were to come up with 1 point estimate, it would look like nothing had shifted in terms of our baseline obesity that we were seeing in the clinic. But if I were to look for subpopulations, and I think that's your main take-home point, I would see a very different story. So as you look forward in terms of demography, what do you think these shifts are that we can expect?
Well, I don't have a crystal ball, first of all. I wish I did. But I mean, the general trends are likely to continue. There's been some leveling off of, in fact, there has been of illegal immigration from Mexico, so there's some slowing of that rate of migration. But in general, we can expect to see, I think, and this is what this based on Census Bureau projections, that the Hispanic population will continue to grow, the Asian population will continue to grow through immigration and now births to all these immigrants who are here and they're not going back. Other groups that you're talking about are relatively small, and to some extent, the folks who show up here depends on where's the latest war, where are we going to be getting refugees from Somalia and Ethiopia, or I don't know where the next war is going to be, although the Middle East seems to be pretty unsettled for now and into the foreseeable future, so we may well be getting more folks from the Middle East. I guess what I would suggest thinking about for the committee will think about is, and obviously is because of the way the structure of this workshop so far, is the national data to try to think about how to squeeze the most information out of whatever sample size we have for Ann Haynes, and then for the youth behavior survey to really think about how to enhance it with 2 or 3 or 4 questions that are required. I understand the states aren't required to ask very many questions, but the demographics are. Some of these demographics would allow us to pinpoint where these populations are. So there are Hmong, for example, in Minnesota and Wisconsin, and Vietnamese, particularly in Texas and California. But that could provide a vehicle for us to get some specific geographic specificity for various groups and to monitor how that's changing. One can use the American Community Survey to do that. And I didn't do those breakdowns. I can send a little bit old data, but some very detailed results for children just from the American Community Survey by specific countries of origin. So the American Community Survey can provide a heads up on that, although it's always 2 or 3 years behind because they have to combine samples to get good estimates, particularly for local areas. But that's a good way to sort of monitor the trends in population over time. And then the other kinds of data which you have been and will be talking about that are sort of more geographic, really local. I said, hey, Los Angeles has a youth behavior survey, and the person from Los Angeles said it's only 1,500 people. So it's not going to serve their need for really local data. There'll have to be other approaches. But the Youth Behavioral Risk Survey will certainly give us information about when we look across all the states of which different groups have relatively high obesity in those places. Because if you ask country of birth and parents' country of birth in that survey, then if the Saudis happen to be in Tennessee, is that where you're from? Mm-hmm. The Saudis are going to Tennessee. It'll show up there if there are enough of them who are going to that locality. And if it's the Hmong in Minnesota, whatever, they'll show up there. So that could also be used to monitor this and tie it to obesity, which is obviously critical for the work of this committee.
Thank you.
So I think we're going to keep moving on with our program, and thank you. It's very interesting.